Welcome to the Codecast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone. Welcome to the Codecast Podcast. My name is Terry Fletcher. Okay, first things first, out of the way. Yes, the Super Bowl's over and the Chiefs won. And okay, whatever. I'm just so over it. And then there was all kinds of things going on at the game. I don't know if you watched it, but oh man, some of the things on the sideline, not okay. You got to be a professional and not beat up your coach or walk into him or punch him or whatever was going on there. Anyway, let's move on to our topic today. See, I'm still salty, and that was a week ago. But let's look at what we're going to talk about today. I'm going to talk about HIPAA violations. Actually, I was looking back on my podcasts, and believe it or not, even with almost over 250 episodes, I haven't talked about HIPAA since 2022. So a couple of things we want to talk about, and remember it's HIPAA with two A's, HIPAA. You know, I have a couple of pet peeves. I just want to get out of the way. When somebody says they want to follow me on LinkedIn or on social media, and do I want to follow them? And I'm just like, I see in their profile that they spelled HIPAA wrong. They don't have a professional English in what they're saying. And it's just, I won't do it. You have to be professional in all aspects, and you need to know your acronyms. So if, it would be like saying CSM instead of CMS. You just have to make sure that you understand what you're putting out there. So just keep that as a word to the wise. Now, I'm not the only one that feels that way. Some employers will look at that as well as maybe not being informed. So let's talk about HIPAA violations, because you may not know this one. And this one took a little research, but I'm starting to see it on a lot of private practice websites. So let's take a look and see what the problem is. So first of all, there are definitely some fallacies of HIPAA. I've talked about this a long time ago, where when it was COVID and people were like, you can't ask me if I have, if I took the vaccine because that's a HIPAA violation. Actually, that's false. Someone who is just a normal person out there, or even a news reporter, if they ask you if you've had the COVID vax, it's rude. You don't have to answer, but it's not a violation. They would have to be a HIPAA entity, or work in a HIPAA entity, or work for a HIPAA entity, or have some kind of relationship with a HIPAA entity for keeping patients, PHI or ePHI safe and private. So that's the first thing. And PHI, in case you didn't know, is patient protected health information. So we want to make sure protected health information or electronic protected health information is kind of the topic. And so here's the violation that I see again on a lot of physicians' websites. And most practice owners don't know it's a rule. First of all, how you collect your data on your website is equally as important as the data itself. Even if the patient may not mention their medical condition, their information may still be considered as protected health information. It could be demographics, it could be healthcare information for their insurance, it could be something that a family member has that's still protected if you are an entity that is involved in submitting claims for them, or any kind of electronic health information. So when collecting information on medical practice websites, such as a portal, or if you're sending an email of paperwork to a patient to fill out before they come in, first of all, only the necessary people should have access. The data is sent in a secure, encrypted manner. The data is stored in a HIPAA-compliant location, and as soon as you no longer need that information, you have a system to destroy that data so it can't be replicated or stolen or anything by anybody, whether it be staff members or non-staff members or just people walking through your clinic. That would be bad. The other thing is you have to make sure, and this is the big one, make sure that any marketing company or anybody that is managing your website, that they understand HIPAA compliance. A lot of them do not. They only understand marketing. And also make sure that the fact that if they do understand it, or hopefully they do, that they have steps to fix it if they don't realize this rule. Because I do have practices now that are now saying, hey, I'm getting a HIPAA violation from the Office of Civil Rights. A patient complained, and that's a division of HHS, because patients are now getting blasted with marketing items and, all kinds of phone text and things related to their intake sheets that they fill out. and they were not expecting that. It also can come from methods of payment, such as PayPal, Cash App, Venmo, because remember, those encourage public sharing. And Venmo is the only one that has a private or friends only option. I use it. I get my nails done and or a pedicure, and it says I can either have it public showing or I can have it as private. And I put it on private. And also, when you enter into a usage agreement, you agree to allow marketers to share your information. So you have to make sure that you sign a BAA, so Business Associate Agreement, again, where they understand HIPAA protections, because remember, they're not HIPAA entities, but you are. So you as a practice, if you allow patients to be exposed this way without privacy options or a warning, then that's going to be a HIPAA violation on your practice. And their medical condition could get into the wrong hands, or the wrong person who may be seeing something from your website, or they're being targeted on your website. I mean, let's face it, there's polls going around. It's a political year, and I won't answer them. First of all, because they always want money, but mainly because I believe that they could be targeting. They could be saying, okay, let's just keep data on this person, because we've seen what the government's been doing, and we've seen what other bad actors do to collect this information. But here's also something you may not have known. So at hhs.gov /HIPAA, again, 2 A's, they have a summary of the HIPAA privacy rules. And so you can Google it, again, hhs.gov /HIPAA, and make sure that you have updated your policies and have this, and they have it in PDF as well, so that you understand the privacy rules and everything that goes with it, permitted uses, disclosures, things about mental health, which are much more strict than regular healthcare services, psychotherapy notes for treatment. It's kind of like HIV back in the day. But here's something that I came across that I thought was interesting. It talks about marketing, and where it's placed is funny, because it's placed right after psychotherapy notes. But they talk about marketing, because I've had people say, well, Terry, marketing has a, they carve out, an exception. I'm like, not so fast. Let's go through it. So first of all, it says, and it's a bullet point. It's a bolded for emphasis bullet point. It says marketing is any communication about a product or service that encourages recipients to purchase or use the product or service. How many times do you go on Amazon or go on the web and say, I'm searching for this, and now you can't stop the related information that you're getting no matter what you're doing. You're, checking email or, looking up research on the internet, and all of a sudden a flag comes by, or some kind of cookies comes by and says, hey, you want to buy this? And I'm like, no, if I wanted to buy it, I would have bought it. Well, patients get that too if the privacy rule isn't in place, if they're not HIPAA protected. So the privacy rule does carve out certain things on marketing, but let me explain what they are. And it even says, privacy rule carves out the following health-related activities from the definition of marketing. It says, first, communications to describe health-related products or service or payment for them provided by or included in a benefit plan of the covered entity making the communication. So if it's an insurance company that's a plan of the covered entity making the communication, then that would be okay, because now that's a covered entity and they would have to have HIPAA protections. The next one is communications about participating providers in a provider or health network plan. Remember, they're covered entities, or replacement plan, or any kind of health plan. And it says that add value to but are not part of the benefits plan as long as the patient has given authorization. And they say communications for treatment of the individual with the patient's authorization, and it's written authorization. And then it says communications for case management or care coordination for the individual to direct or recommend alternative treatments, therapies, healthcare providers, or healthcare settings to an individual, again, with patient authorization. So even though they're carving it out, they're saying if the patient says it's okay. Then they go on to talk about the arrangement between a covered entity and any other entity where you're getting paid. It says in exchange for direct or indirect remuneration. So if you're getting paid to disclose protected health information, let's say for AI purposes, and this is where it gets a little dicey, or for statistical purposes, okay, from someone that isn't a HIPAA entity. So it says a covered entity must obtain an authorization to use or disclose PHI for marketing. Anything that's face-to-face, so actually, the vendor's coming in and the provider and the patient's there, that's actually covered. And that's fine. But if there is value, it says that an authorization for marketing that involves the covered entity's receipt of direct or indirect remuneration from a third party, you have to reveal that fact. So you have to tell the patient, by the way, I'm getting money for them to market you. And then the patient has an option to say, no, you can't do that. It's kind of like when you search something out and it says, when you try something on Google, it says, can we track you? No, you can't. That's one reason why I don't use TikTok. That's why it's banned on all government devices, because they track. They not only track, they gain access to your information, and it's from a foreign country. So this is where marketing, you might think it's harmless, but when it comes to what is appropriate for patients and what they want you to be able to access and what you're telling them they can access are maybe two different things. So just make sure on your websites, on your portals, any place where the patient is filling out information for them personally or for a sibling, a parent, a child, that you have HIPAA protections and your marketing team is aware of that, or anyone that's managing your social media sites or anything like that. Otherwise, that can definitely be a problem. I just don't want you to get in trouble with that. The Codecast podcast is also brought to you today by Select Coder. Get all of the decision-making information you need to code in a single online resource. Select Coder offers you the comprehensive coding guidance required to accurate claims the first time. To learn more about Select Coder, visit codingbooks.com/Select Coder. Okay, so personal tidbit this week. Oh my goodness. So I mentioned the Super Bowl, but I'll just mention something else. If you're looking for just a different show to stream and you're just trying to figure out, you don't like some of the new shows that are out there, I mentioned Suits. I love that show. And I still have it on in Noise in my office just because I've already watched the season 1 through 9 twice through, and I'm now on the 3rd time through. But there's a show out there that it was around for 6 seasons called Numbers. Now, it's a very smart show, you have to pay attention. You have to put your phone away, not even look at it. Put it on silent. Tell everyone you're in the middle of something, because if you don't pay attention, you'll miss something. But it's really interesting just how numbers and factoring and figuring all, it's about FBI, just how it all kind of intertwines, not just money, not just math, but math has a lot to do with everything we do out there. So just a suggestion if you're interested in trying to find a show. It is a throwback. So it was from, I think, 2015 through 2021. So anyway, good luck with that. I like it. We're on the 2nd season, so we'll see what happens. All right, everyone, make it a great day and a great rest of your week, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.